Welcome to Ideagen TV. Today we are thrilled to have with us Dr. Gene Accius. Gene, welcome.
Hi, George. How are you today? Thank you so much for having me.
Gene, your work at AARP is absolutely profound, my friend. I've had an opportunity and a real privilege to watch you in action, to see the passion, the commitment, and just the overall impact that you're having at AARP. And it's just remarkable. For those across the planet that are able to watch this broadcast, could you kindly describe for them your role and responsibilities at AARP?
Well, again, thank you so much, George. I really appreciate our conversation. What I will share is that before I get into my role, it might be helpful just to give a little bit of background about AARP. AARP is a nonpartisan, nonprofit organization dedicated to ensuring that older adults and their families have the opportunity to choose how they live in age. We were founded in 1958. Our founder was a retired principal who went looking for her friend, who was a retired teacher, and found her friend living in a chicken coop, a shack, literally with no walls. And outraged by that, she created an organization called AARP, dedicated to ensuring that all older adults have an opportunity to age with dignity, independence, and purpose, and have access to healthcare and financial security, particularly as they age. That has been our mission for the last 60 plus years, is to ensure that everyone has the opportunity to age with options, to have the tools and services that they need in order to live a life that they've defined as part of how they want to live in terms of how they want to age. In terms of my role at AARP, I have the great pleasure of working with a high performing team to really help position AARP as a global thought leader and thought partner, and helping the world see and value aging from a position of strength, not necessarily a position of a liability. And what I mean by that is the fact that we know that one of the key trends across the globe is the fact that people are getting older. Not only are they getting older, but they're living much longer. And we have a tremendous opportunity to embrace and harness that growth in a way that drives economic value to countries and societies and businesses, but also ensures our fabric, our social fabric, in terms of strengthening our communities and our families. I have the great pleasure of leading a high-performing team and helping us think strategically across the entire enterprise in terms of how do we elevate big solutions, big ideas that really engages and cultivates different partners across industries and sectors, and changing how the world views and values aging. And I am extremely honored by this role in the work that we've been able to do to really shift the paradigm, change mindsets, and create new systems that would really allow people to reach their fullest potential.
And therein lies what is so profound. You do have a very high performing team and a high impact team, and we're seeing the results across the board in everything that you're doing at AARP. And I think what's really exciting is that you see that cohesive sort of oversight and sort of overview of the entire field, which is the AARP community, which I am a member, by the way. So, and as we look at these people over 50, like myself, I am a card-carrying member of AARP, a very proud one, by the way.
Thank you.
A very, very proud one. And I'd like to know, Gene, in your opinion, what are some of the most important, perhaps the most pressing issues that those individuals over 50 are facing today?
Well, first of all, thank you so much, George, for being a card-carrying member of AARP. Hopefully, we are doing you service and representing you well. You are an amazing example of how aging, particularly in the U.S., it looks good. And as I tell people all the time, as you get older, there's wisdom and experience and value that comes with that. So embrace it. With respects to some of the major issues that I know and I think we're all grappling with, particularly in this current climate, as relates to the impact on people over the age of 50 in the US in particular, clearly there's huge economic implications. We're seeing increases in terms of inflation, increases in terms of cost of goods and services, and which disproportionately impact those that have limited and fixed income. So really thinking about the opportunities to ensure that people have the economic means to match their life aspirations is something that we're doing very intentionally at AARP. The other area that is of critical importance for people over the age of 50, and frankly for workers of all ages, is really thinking about the changing labor market. And whether it's the great resignation, the great reshuffle, the great reflection, the great reorientation, whatever the great is, what we do know is the fact that a lot has changed over the last 2+ years and counting. And we need to think about how do we leverage the skills and the insights and the wisdom of a multi-generational workforce. Many companies are managing 5 generations at any point in time. And those companies who are able to leverage that age diversity are those companies that are going to be more competitive in the marketplace. We also know that age discrimination is rampant. We've seen that accelerate, particularly since the pandemic. In fact, we've been doing a survey for many, many years, and nearly 75% of those respondents indicated that they've seen or experienced age discrimination, particularly in the workforce, which is one of the highest numbers since we've been actually collecting this data. So whether it's the economic implications in terms of exactly what we're seeing, which has a ripple effect in terms of the workforce and a lot of the shifts that we're seeing in the workplace, and even in some cases, people returning back into the labor market because of the cost of living has increased so significantly, or the age discrimination that exists, which is stifling economic growth for all of us, we have some major issues to address. In addition to the financial issues that I just mentioned and the workplace issues that I just mentioned, we also have to grapple with some of the inequities. And I'm going to refer to inequities in a couple of ways. One is the fact that not only is the population aging, but we also know that in many cases, people are living much longer. Now, what we also know is the fact that just because someone is living much longer, their ability to live those extra years in good health has not kept pace. So in other words, we are seeing an increase in life expectancy, but we're not seeing an increase in healthy longevity. So you have this huge gap. So how do we start to address those inequities within and across countries, across the globe is a huge issue that we're going to have to grapple with. Most recently, the National Academy of Medicine released their global roadmap for healthy longevity with a series of solutions and proposals and recommendations to try to close that gap and to ensure that as people age, that they're living healthier, longer, more prosperous lives. And I think that's a call to action for all of us, whether you're in government, whether you're in the private sector, whether you're in the nonprofit sector, whether you're just an individual. How do we collectively embrace a society that's healthier and more prosperous, particularly as they age? And that's something that we all have to rally around. In addition to the inequities that we're seeing between how long someone lives and how healthy they actually live, we also know that there's significant inequities, particularly as it relates to race, ethnicity, and other demographic factors that we need to address. And the population, particularly in the US, is becoming not just older, but more diverse. So we do have some opportunities to think about our interdependency as a society in a way that really ensures that we're co-creating solutions and bringing those who have historically been in the margins to the center of the solutions that we create.
And these are all incredible insights and perspectives, Gene, because we're all seeing the effects not only of the inequities and inequality, but also of what we all experienced, which is the global pandemic. Mm-hmm. You can argue whether we're still in the pandemic or coming out of it, or whatever level we're at. For the first time in human history, the entire planet experienced the same exact situation. Mm-hmm. We'll call it a situation. And here we are today, wondering whether there have been permanent effects, perhaps. What are the effects that you've seen, Gene, that are affecting those over 50 in terms of the pandemic? And do you think those are mostly positive or not so positive?
Mm-hmm. Well, I think that's a great question, George. I think that this pandemic has demonstrated, reminds me of that phrase. This was the best of times and the worst of times, and there's no doubt that these last 2+ years have been some of the worst of times. Whether it's the millions of people who've lost their lives to to the virus, or the number of people who've been impacted in terms of lost employment opportunities. Nevertheless, COVID really turned our worlds upside down and everything in between. And I think that on the positive side, it forced us into this great experimentation where we had to really reflect as individuals and collectively what our values are, what our priorities, how do we want to spend our time. And I think we're seeing some of that, given a lot of the shifts that we're seeing in terms of people leaving their current employers for other opportunities, or in some cases, to go back to school or to do something drastically totally different from what they've done before, or this greater desire to be in the driver's seat of one's own destiny in terms of how they allocate and spend their time. So this, on the positive side, I think that has generated some greater thinking and some greater reflection in terms of exactly who are we, the collectively, and what we value and want to become. I think clearly that it also presented some of the structural and systemic challenges that we need to address, particularly in the context of long-term care, and what we saw and continue to see, particularly for residents living in nursing homes, and the devastation that this pandemic illustrated, whether it was just a significant loss of life, the inability for families to actually engage with their loved ones in a nursing home, the inability of residents within a nursing home to be able to engage with each other. So I do think that we have some fundamental issues that we need to address structurally as relates to ensuring that older adults have the services and supports they need, particularly as they age. And what are the innovative models, whether it's a greenhouse or smaller homes, or opportunities to be able to connect in a way should and if another pandemic should present itself.
Absolutely phenomenal in terms of the way you describe that and the impact and the breadth and depth of what we're dealing with. And I'd like to shift a bit, Gene, to policy.
Mm-hmm.
So we're in Washington, D.C. We hear about policy each and every day. How do you see policy currently being affected by the ability and its ability to reduce issues surrounding everything we just talked about? So how does this national policy currently affect the ability to reduce the impact of everything we talked about?
Yeah. So that's a couple of things, George. One is the fact that at its most fundamental level, policy is designed to alter behavior, whether it's at the individual level, whether it's at a systems level, or whatever that unit of analysis is, whatever you're trying to do. And within policy, there are certain values and certain ideas that are being tested. And I think it's fair to say that clearly, given what we're seeing with this pandemic and what we're going through as a result of this pandemic, whether it's the economic implications, the health implications, a mixture of both, that policy plays an instrumental and critical role in helping to figure out how do we solve some of the challenges that we face, and how do we measure the impact of those challenges through these different policy ideas. We are currently at a crossroad, I think, in terms of thinking about what that post-COVID world might look like. And I think that one of the things that this pandemic demonstrated that I don't think we talk a lot about is how global we are and how interdependent we are. Meaning the fact that what I do impacts you, what you do impacts me. And we're seeing this in so many different trends, but I'm just using the pandemic as a clear example of this, whether it's the variants or the subvariants that literally is spreading across the globe. So that means that in some cases, we need global collaboration and global solutions. We need global alliances. We need to think outside the box in terms of who's at the table and who's not, and that should be at the table. We need to think about what are the opportunities to partner with public and private sectors in a way that identifies the challenge and also identifies the opportunities, and not let perfection be the enemy of the good. And I think that that is one of the key things that policy can help us do, is to really think about ways in which we can solve many of these big issues from a systematic perspective in a way that accelerates our pace and hopefully helps to solve some of the challenges that we're trying to solve, whether that is the increases in inflation, or whether that is the issue around the supply chain, or whether that is the issues that we're seeing in terms of the rising cost of gas, or whether that is the pocket issues that's impacting people with regards to their prescription drugs. And I know one of the big things for AARP is really working, particularly on the policy and advocacy front, to ensure that older adults have the opportunity to get affordable, high-quality prescription drugs. And that is a policy decision. That is a policy lever that would, if we were to move in this direction, would allow Medicare the opportunity to negotiate in a way that actually lowers prescription drug costs, which benefits consumers of all ages. So I just use that as an example of how we can take a big problem, leverage the range of policy ideas and different actors across sectors and industries to coalesce to solve in a way that ensures our broader prosperity as a society.
And what I really enjoyed about your description of all that, Gene, is the fact that you zeroed in on that global interdependency. And I think if anything has been highlighted during the pandemic, it's that the world is actually a really small place.
It is.
And when you think about every person on the planet experienced the pandemic in just about the same way, it's profound. Mm-hmm. And yet we're all interconnected, no matter how far, no matter where you are on the planet. You're right. Every action has an equal, impact on other people across the world. So your action impacts me, and like I love that description. And I'd like to change a little bit of the focus from those of us that are over 50 to maybe those of us that are not. And so the younger generations, as they're coming up, I still think we're young, but the younger than us generations, and I'll just put myself in that category. How do you see issues that they're going to be facing? In other words, if you had to predict potential issues that they're going to face, what would they be, and how would you address them?
Right. Well, I think one of the things we're going to have to address is the rising inequality, and how that impacts different demographic groups and even different generations. I think that whether it's the Great Recession or this pandemic, it clearly has impact on different cohorts. And we're going to have to think very strategically about how we address the equity issues as a result of some of these broader challenges that we face as a society. And I think that's critically important. Oftentimes I hear people use equity and equality interchangeably, and they're not the same thing. Equity suggests that you need to have a targeted intervention to be able to meet the current conditions of an individual, meaning that there will likely be variation. What I need might be different from what you need, George. And as a result, we might need different interventions to bring us to the same level. And I think that is something that we're going to have to think very strategically about, particularly about the different generations. How do we ensure that they have the tools and the resources and the opportunities to be able to really thrive and not just survive? How do we address the issues of student loan debt, which not just impacts younger people, but also, I should also say, older adults who may have taken out student loans for themselves, for their families, or their grandkids? How do we ensure that, in addition to addressing the issues of student loan debt, that we're tackling some of the broader issues that different generations are facing. I do think that one of the things that we'll also need to grapple with, and we're seeing this particularly across the board, is mental health and mental well-being. I think it's fair to say that we all have gone through a collective trauma. And I know we're seeing a lot of the data that in many cases, the younger population has been disproportionately impacted, particularly around the issues of mental health and suicide rates relative to other generations. So we really need to think very strategically and very intentionally about how do we provide the support and the services to ensure that people are living, particularly the younger generation, as well as all ages, are living a life of total well-being, emotional, physical, mental, and have the means and the resources to be able to navigate the complexity of issues that we have to face collectively.
Just incredibly, inspiring to hear the way, you laid all that out in succinctly, to talk about the definition of equity so that people understand it, and understanding the impact that issues in our society and societies across the planet will have on the well-being of everyone, quite frankly. And so it's in everyone's best interest to really have empathy, right? To have that empathy, to understand exactly what it is that we're facing, both today and tomorrow, and where we've been, and to never forget where we've been. That's another key piece, is never forget.
Well, I think part of the never forgetting is the fact that we're seeing this. I'm just going to venture to say that I think we're seeing some of the ramifications of what we've been through and are going through currently in different ways, whether it's the outbursts or the anger, the grief, the sense of loss, the frustrations of everyday people. I think we're seeing that manifest itself in so many different ways. And I hate to say this, but I think that the tough part is yet to come. I think we have a long ways to go to be able to process what we've been through collectively. And I think that different generations and different groups are dealing with it differently. And I think that the point that you made, George, about empathy is critically important. And part of that empathy is to understand and to give space for a sense of grace. And I think we can all extend that sense of grace to everyone, frankly, because we are all dealing with or have dealt with or trying to process what this great experimentation that none of us signed up for, but we found ourselves in it overnight.
That's exactly right. And thank you for that. It's just helpful for those individuals across the planet that are watching and will watch this broadcast to have just that critical perspective. And I'd like to pivot a bit to international. So we've talked a lot about interdependency, the impact that one individual makes here impacts someone perhaps across the world. And I'd like to ask you, Gene, are you seeing policies, issues, practices that are being and helping those over 50 in other parts of the world that you feel could be applicable right here in the United States of America?
Yeah. So I think that's an excellent question, George. We released our Age, Readiness, and Competitiveness report, where we actually looked at innovations across the globe, particularly as it relates to health and long-term care. And your viewers can go to AARP International to look at this dynamic website that not only identifies what some of those innovations are, but also quantify the number of lives saved and dollars saved as a result of those various different innovations in the context of whether it's the opportunity to be able to age in your home and community for as long as possible, or the opportunity to think about ways to integrate health and long-term care, or the opportunity around telehealth and being able to give and ensure people have access to telehealth and telemedicine, regardless of where they actually live in a particular country. So the Age, Readiness, Competitiveness report identifies many of those innovations that are potentially scalable. That was one of the criteria that we wanted to use is, what are the innovations that are scalable? And there's some amazing examples, particularly through this report, that I want to highlight and encourage your viewers to, again, go to our AARP International website to take a look at. Whether it's in Vietnam, where there's this opportunity, again, to think about ways in which we can address the issues of telehealth and telemedicine, where providers are utilizing mobile clinics to go around in very hard to reach communities to ensure that people are getting access to healthcare. Or whether it's in the context of ensuring that people have opportunities to get long-term care in their homes in the Netherlands, or trying to address the issues of dementia, particularly as it relates to the loss of cognitive impairment. So there are various different models and innovations that are taking place, because we know that when you take into account and you have a strategy for meeting the needs of an aging population, it actually benefits all populations. And in fact, it's similar to what we've seen in Singapore in terms of having their master plan for aging. And now we're actually seeing many countries, and within the context of the US, many states adopt a master plan for aging. And I think that is critically important, is to really have a vision for how the country, how the community, how the state is going to respond to the growing need of an aging population. And in addition to that vision, having a strategy that cuts across public and private sectors, where all these agencies and all these groups are working together to operationalize and to execute on that vision, is quite monumental. In California, where California actually has a master plan, that master plan has been used as the blueprint, as the North Star for allocating resources to executing on those recommendations. And now there's 26 states in the United States in particular that are that have expressed interest, and that's part of this journey of creating a master plan. As you can see from my response, it started with Singapore, that has replicated itself in the US. And now nearly half of the states in the US are either implementing or in the process of implementing a master plan for aging. And we are seeing the success of just having a blueprint and having agencies and organizations working together to execute and intentionally design an age-friendly society and the benefits of that. And that started with countries like Singapore and several different other countries. So those are just some examples of the opportunities to be able to share innovations, both within the US and exporting those innovations to other countries, as well as the reverse of importing innovations from other countries to the US.
In healthcare, clearly AARP leads on every level in terms of advocating for the best healthcare, especially for those over 50, right? And so we're dealing with a healthcare system that's complex, okay, but it has so many issues associated with it. Mm-hmm. Some positive, some not so positive. In your perspective, with your perspective from AARP, what can we be doing better in the United States to provide better healthcare, just better health in general to those over 50?
Well, I think you nailed it. A couple of things. One is the fact that we know, in comparison to some other industrialized countries, that the United States spends so much more in terms of healthcare and healthcare spending, yet we have poorer outcomes relative to our other industrialized countries. So we have an opportunity to think about how do we create a healthcare system and a culture of health that fosters better care, better population health at a lower per capita cost. I think part of that is actually creating a system that actually puts the person and their families in the center. I don't know about you, George, but my experience interacting with the healthcare system has always been frustrating. Trying to figure out exactly who to call for what I should be paying, how many conversations I need to have just to get the services that I need. what other industry, what other sector where you could treat the customer like that and still be in business? I can't think of one. And I think that's what we need to do, particularly within the context of transforming how we deliver care, particularly in the US, is to ensure that it's really person and family centered. And I put the family in that in part because of the fact that we know that there are millions of family caregivers who are doing complicated medical nursing tasks like giving injections, wound care, tube feedings, and never got any training to do so. In fact, I know of a colleague who was a caregiver for her mom, and she said that she had to give her mom injections, and she never knew whether or not she was helping or hurting her mother. That's outrageous. So we have a healthcare system where there is this presumption that someone will take care of you once you get discharged. And I think we need to ensure that the family is part of that care team and that we're delivering care around the preferences and wishes of the individual. And that this is a person, not just a patient. You are a person 365 days throughout the year. You might be a patient for a couple of days out that year. So how do we start to ensure that we see, we understand, and we value the wishes of the person to whom we have been entrusted to provide their care? And I think that is the transformation that needs to take place, particularly within our healthcare delivery system, which will have huge implications in terms of the financing as well.
Well, and Gene, in a few short minutes, you succinctly laid out the issues that we need to attack with our healthcare system. That is profound, my friend, and not easy to lay out like you just did. That's why you're a thought leader globally. And that's why I'm proud to say that you are changing the world on every level. And speaking of changing the world, as you know, back in 2015, every single member state of the United Nations voted affirmatively to espouse the 17 global goals of the United Nations. Those 17 global goals, beginning with no poverty and going all the way through to global partnerships, that we at Ideagen Global espouse, and I know that you espouse at AARP. And so I'd like to ask you, Gene, what is your favorite goal and why?
Oh, that's a trick question. That is a trick question. You know, I think what really kind of sticks out to me, if I may, I think that if we don't address the issues of equity, if we don't address the issues of employment, those two are connected in very fundamental ways that will actually not impact just older adults, but will impact generations to come. And we need to think about how the policies and the programs that we either have currently in our countries, in our societies, in our communities, within our own organizations are fostering greater equity and greater opportunities of engagement. And to what extent are some of these current policies, programs, and practices exacerbating, either intentionally or unintentionally, those issues? And if we don't address the issue of equity as a core, then we have done ourselves a major disservice, in part because we know that inequity stifles economic growth, whether it's in the context of age discrimination, whether it's in the context of racial disparities, whether it's in the context of the intersectionality of age, race, and gender. Whenever people are marginalized, whenever people are excluded, it does not just hurt them, it actually hurts all of us, because that is lost opportunity for them to contribute, whether it's contributing in terms of their productivity, whether it's contributing in terms of the connectivity to their communities, their families, and our social fabric, whether it's the lost years, the lost lives, that has huge implications, which impacts all of us. So if we don't get that right, if we don't solve for that, then it's somewhat quite difficult to address the others.
And that's sort of a sad epitaph, isn't it? To say,
is.
when you think about it so appropriately so, as lost opportunity. It's just sad. It's just sad and pathetic. And I think you laid it out again, Gene, so well, so powerfully. And I'm deeply appreciative of that, because I think for our global audience to understand the importance of the global goals, the importance of equity, the importance of empathy, it's all aligned with all of the goals. Greater economic productivity, and on and on and on. It's just good. It's just good. How about that?
It is.
So shifting to the more good, what are some of the incredible projects, current, upcoming, that you'd like to either announce or point to that you're working on right now at AARP?
Well, there's two that I'm just going to mention to this global audience, and that we're really excited about. And there's several, so I will not pick a favorite. What I will say is the fact that part of our conversation today was that everyone has value, everyone has an opportunity to contribute, and everyone's voice matters. So with that, we are going to be releasing a global longevity economy report later this fall that actually outlines and provides for every country the economic contributions of older adults in their particular country. So in other words, you will have an opportunity to see what is the economic contributions of older adults in your country to the broader GDP, how many jobs they're supporting, how they're giving back to their society, with the goal of demonstrating that older adults across the globe, they're not a liability, they're an asset. They're an amazing resource that's waiting to contribute and to be tapped for opportunity. And those countries and those leaders and those business leaders who understand that, who have a longevity plan, who have created a master plan on aging, will be more resilient, more powerful, and more inclusive moving forward. So that is one major project that we're doing with the Economist Intelligence Unit, or Economist Impact now, that we are going to be releasing. And it's this global longevity economy. And you'll have the report, and you'll also have country-specific fact sheets that outlines the specific data around older adult contributions in a particular country. So I'm really excited about that. The second piece is actually connected to this greater work, is that we're going to be doing a major effort around the business case for healthy longevity. As I mentioned before, that we have an amazing opportunity to close the gap between how long people live and how healthy those years are. And there is a benefit, both in terms of a social benefit for our communities and our families, but also an economic opportunity. And I believe that there's a role that the private sector can actually play, because we know that the workplace where you work is a social determinant of health, and that employers and private industry have an amazing opportunity across the globe to think about ways in which we are articulating that employer value proposition in a way that acknowledges the total well-being of your workforce. So those are two major initiatives, George, that I would love to continue to talk to you and partnering with you in Ideagen, and for many of your viewers today, where we could really get together and think about how we accelerate the pace of change.
Dr. Gene Accius, you are a global thought leader, change maker,
Wow.
and someone who is making an indelible and leaving an indelible mark on this planet in an incredibly powerful and positive way. And I'd like to ask you on that note, as a final thought, leadership. What are the qualities that you believe every leader should embody?
I think empathy. I think empathy is critically important. I think the opportunity to understand what your workforce, what your team is going through, I think is critically important. I think that it's fair to say that even though you may have some team members who've been with you pre-pandemic, they may be physically the same person, but they may not be the same person. So we have to go through a process of getting to reacclimate, reacquaint reconnect with each other because so much has changed in the last 2+ years. So I do believe that one of the critical skills or features of an effective leader is one who can listen first, one who can empathize, one who demonstrates that they actually care about my well-being. And I think that those leaders who can create a culture of empathy and caring are more likely to see lower turnover and greater loyalty and productivity from their workforce.
Dr. Gene Accius, AARP, you are indeed, my friend, leadership defined. Thank you so very much.
Well, George, I just want to thank you. I say this often that if I ever want to feel good about myself, I need to call George because George will build up your confidence in an amazing way. But with all seriousness, I just want to thank you for your leadership and your partnership. I have learned so much from you, and I continue to be grateful for our friendship.
Right back at you. Deeply grateful, empathetic, and thank you for all you're doing to change the world, Gene. You are changing the world on every level.
Thank you, sir.
Thank you.